Hello, and welcome to the Postpartum Years podcast. I'm your host, Dr. Ellen Kramp. I am a physical therapist and a pelvic health specialist. Joining me today is a fellow physical therapist, Lynn Schulte. She's pretty well known in the pelvic PT arena. She is also an educator of other PTs, as am I. And today we are going to be discussing a topic that's very common in the postpartum population. We're going to discuss diastasis recti. So before we get started with that, I want to give you just kind of the little briefest overview. I will have another podcast totally dedicated to like going in depth about this, but what diastasis is. So diastasis is a separation of the abdominal muscles. The most common ones after pregnancy is basically from the rib cage down to the belly button and kind of through the belly button. And it can also be all the way from the rib cage down to the pubic bone. It can be just from the lower, from the belly button down to the pubic bone. But for the most part, it's usually above the belly button and all the way to the rib cage. So welcome, Lynn. Very
Thank you.
nice to meet you. Glad to have you on my podcast.
Thank you for having me. I love talking any of these topics, Mary
I
Ellen. So
know, I
let's
know.
dive in. Oh,
All
did a
righty.
great job there with the diastasis definition there. And there's the connective tissue that actually holds the recti muscles, and the recti muscles are those six pack that you see on oh so few people. Right? But those six-pack belly muscles that run from the rib cage down to the pubic bone, there's a linea alba that is a connective tissue that holds those muscles together. And what actually happens if we're going to talk about diastasis recti and how to help heal it postpartum, we really have to go back and start during pregnancy. Okay, because during pregnancy, that linea alba that holds those two muscles together, we need to understand the different types of collagen in our bodies. So we have type 1 collagen that is really stiff and it helps hold those muscles together. And then we have type 3 collagen that is stretchy. And during pregnancy, the type 1s in the linea alba decrease in number and the type 3s increase in number so that we can allow those muscles to separate to allow for the expanding uterus as that baby grows. So it's a natural happening, a natural occurrence in the body during pregnancy. And you were talking about it could be above the belly button, it could be at the belly button, it could be below the belly button where we get greatest separation. But at the belly button is probably the most common I find in my practice. Do you find that as well?
I find above the belly button to be the most common in my practice, above
Yes.
and sometimes through the
Yes.
belly
So
button.
even though most people who don't have a big separation, there's more that happens at the belly button as far as separation goes, just because that's how we're anatomically made. There isn't as much some structure of pulling that together because of the belly button. And so during pregnancy, the type 3 collagen helps to stretch that out so that the muscles can separate. And Mary Ellen, I'm not 100% sure on, I think Jill Basalt's research talked about 80 to 100% of pregnant women develop diastasis in pregnancy. Is that correct? Or have you?
I've read some studies that show, yeah, there's, if you define diastasis as greater than 2 centimeters of separation,
Yeah.
then yeah, just by the stretching of the abdominal wall, I would say it's probably close to 100%.
Yeah. What I say diastasis is anything above what you were before being pregnant. But Taryn Hallam is a physiotherapist down in Australia. So down in Australia, they call them physiotherapists and not physical therapists like you and I here in the States. But she does a research review every year. And it was such an interesting story that she put together for us practitioners in going over the research. And she actually found that um, there were some plastic surgeons that did some research and tried to determine what's the optimal distance between those recti muscles. And they were saying, and I don't remember all the different numbers because I really don't think the numbers matter as much, Mary Ellen, as far
Hmm.
as how far apart the
Right.
muscles actually are. But they were only looking at nulliparous women, so women who have never had a baby. And they were trying to say that that's normal. And I love Taryn's take on this because she says, it's kind of like looking at our breasts. If we look at breasts before we mature, when we don't have any breasts, and then we go through maturation where we develop breasts, after a while, do we want to get rid of those breasts and go back to no breasts? So that's similar to what happens to the connective tissue during pregnancy. Like it separates during that process. Do we or should we expect it to come back together exactly like we were before we got pregnant? You
But
know?
what I found in a lot of the research, they would look at just the distance, but very, very, very few studies were looking at function. And
Yes.
one thing that I have to look at when I'm evaluating my patients with ultrasound is like, sure, I'll look at that distance, but I want to see how is the rectus abdominis firing
Yeah.
and how are the major four abdominal muscles firing in concert together? Is the internal oblique just like taking over everything,
Yeah.
or are they all firing together, but the muscles are staying separate? So
Yeah.
I'm not seeing that in the research where
No,
they're looking at the coordination of the muscles firing.
they're just looking at distance. They're looking at what we call IRD, the intrarectal distance, the interrecti
Hmm.
distance, and everybody is so concerned about how far apart that is. And what you're talking about there is does your abdominal wall work well after you have a baby? Now, there's also aesthetics though that we need to be aware of. And most moms, they don't want to have a massive separation after birth or after their kids are out of their belly. They want their belly to look good afterwards too, right? And so one of the things that we're our understanding with the research is that there really is no way for you or I or anyone to be able to determine who's going to have a separation after being pregnant and who's not.
Hmm.
Okay, so that it really comes down to genetics and it comes down to your tissue, the quality of your tissue, and how much type 1 versus type 3 you have in your body. And what we tend to think is that the larger the separation during pregnancy, the larger separation we're going to have postpartum. But that's actually not what we're finding in the research. And it comes back to the quality of our tissue. So, there are different types of people. There are people who are really stiff, and there are people who are really, really bendy. They're very, very flexible. Like if you can pull your thumb back, it touches your forearm. Your pinky goes past 90 degrees when you pull it backwards. Your knees might hyperextend when you stand up. Those types of people whose bodies can do that, they tend to have a lot more type 3 collagen in their tissues in general. And so when we have more of that type 3 collagen in there, the body has a greater ability to stretch out and it also has a greater ability to recoil. So to pull things back together again. And so we really don't want to get too stuck on, oh my gosh, it's so separated during pregnancy, and then thinking that you're going to have this large gap after pregnancy. That's actually not true. Because if we
Hmm.
separate really wide, we may have the ability to recoil really
Hmm.
well and pull things back together again. And so, one of the things that we need to be aware of, you were talking about function of the abdominal wall. And Um, some of us as physical therapists were thinking that that linea alba is the ability of the muscles to transfer load from one side of the abdominal wall to the other side.
Hmm.
And that we have to have stiffness in that linea alba in order for there to be a transfer of the load from side to side. And what we're finding actually is what the newer research is telling us is that actually there's another option for our body. Thank goodness our body is amazing at having different abilities to do the same thing. Like breathing. There are like 4 different ways that we can actually breathe. Thank goodness, because that's what keeps us alive, right? And after being pregnant, we really got to figure out how to breathe so that our lungs and ribs and diaphragm are all working together so our core can be strong. So that's a big thing we have to focus on postpartum. But with pregnancy, and the separation of the abdominal muscles, what they're finding in the research is that the strength of those recti muscles postpartum are the weaker they are, the greater the separation, the greater the increased back pain, the greater the less function someone has postpartum. And so what we're coming to understand is that during pregnancy, it's super important for us to keep our entire abdominal wall strong throughout the pregnancy. There's a lot of programs out there that just focus on the transverse abdominis muscle, and that's a muscle that starts in the back of your lumbar spine, your lower part of your spine, and it wraps around like a corset and it goes directly front to back. And everybody's so keen on just hugging your baby back to your spine. Just hug your baby back to the spine. That's the only thing we should be doing during pregnancy. But I'm here to tell you that it's actually okay and beneficial for us to be doing some crunches during pregnancy. It's okay to do some twists during pregnancy because we want to keep the entire abdominal wall strong during pregnancy so that we have something. All those muscles you were talking about, the oblique, the transverse, they attach into the recti sheath. And the recti sheath are like these stabilization pillars that the abdominal wall pulls from. And if we have weak pillars, then it's going to be harder for those muscles to pull and generate force from side to side. And so it's not just the linea alba that transfers the load, it's the strength of the recti muscles that help facilitate that as well. And I like to think of those recti muscles like a sausage. Okay, sausages have a casing that the meat is stuffed into, and that casing is when the sausage is stuffed full, the casing is stiff, right? And for that's what we want to do for the recti muscles. That's what I want you to think about. But if we don't use those muscles the entire 9 months we're pregnant because everybody's told us to roll over onto our side and then push up and not to just jackknife up or sit up like a curl up, we are losing the muscle mass of those recti muscles over those 9 months. And the stuffing in the sausage is weakening and it's not as stuffed. Okay, so now those pillars that those abdominal wall need to pull on, they're weak. So there's not as much tension for the abdominal wall to pull on. And so we want to try to keep those recti muscles as stuffed as possible, the muscle fibers to be as bulky as possible throughout pregnancy. So once baby comes on out, our abdominal wall has something to work from. Does that make sense?
Hmm. Yeah,
So
definitely.
that, that is the biggest change that I'm doing in my practice since learning all this.
I have found that restrictions in different areas can tend to neurologically shut off or dampen the signals to the muscles as well. So somebody
Yes.
who had a pregnancy and they may not have had a huge baby, but just the way everything was situated, things kind of got jammed. and then a lot of tension in the low back, maybe the connective tissue that sits around the kidneys are kind of squishing things
Yeah.
in and back.
Yeah.
And so neurologically, the brain's like protect, 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 protect. And so when that person tries to sit up, because there's so much tension in the back, the muscles are just kind of going, no, I'm just going to sit
Can't
here.
do anything.
Like,
Help.
no, no, oh, I'm turtling. I'm turtling. So,
Can
yeah,
you guys
so it's
imagine
just,
that being on a turtle shell with the legs waving in the air? That's a perfect example of that.
yeah.
You know, I actually think the kidneys are really impacted by pregnancy, and that the baby, and the kidneys are not supported by any ligaments. They're actually kind of sandwiched into place.
Hmm.
And the transverse abdominis muscle is one of the posterior fascia of the transverse abdominis, helps hold that kidney in place. And I find that, like you were talking about, that pregnancy can kind of shift where those kidneys are positioned in the body, and helping to get them back into place postpartum can be super helpful in activating that abdominal wall too. There's so much more beyond the muscles and the
Yeah.
the bones that we're not fully addressing in a lot of physical therapy sessions. You and I both do visceral manipulation, and I think we find that adding that to our practice really helped increase our
Hmm.
success with our clients, right?
Big
Um,
time. Big
yeah,
time.
big time, because our body is just, I think, and that the organs actually influence the function of the muscles.
Yeah.
And when we release the organs, then the muscles can just function better without you having to do 1,000 sit-ups to make it,
Yes,
work.
exactly.
And
Yeah.
that's, I am not a big fan of, like, let's just exercise our way out of a problem. I think that, if when we get the body working, and when we get the body in a position that it's supposed to be in, everything works normally anyway.
Hmm.
That there's a reason the muscles can't function, and if we can figure that out, then we don't have to struggle so hard to make it happen. But
Yeah.
um, back to the recti muscles and this diastasis, because I love this. Taryn Hollamite, interviewed her for my podcast, and she said, there's no other animal in nature who gets pregnant and says, I should stop doing this one motion because I'm pregnant. And that's literally what we have been telling pregnant mamas for years now. I know I have been doing that in my practice until I learned otherwise, and now I'm changing what I say to my mamas. And I have seen it postpartum. I've had a mom who's pregnant with her fourth, and she cannot sit up because she has not used her recti muscles to do a curl up in 4 pregnancies now. And we are getting those recti muscles are weakening, and that could be contributing to a greater separation of your abdominal muscles. So your
Hmm.
diastasis recti might be larger because we're losing the strength of those recti muscles. So during pregnancy, everybody listening in, please keep your entire abdominal muscle wall strong. Do some crunches, do some curl ups, do some twists. It's okay. And everyone's like, "Oh, we've been so afraid of the doming." So that is when you go to do a sit up, you may notice that the midline of your belly actually domes upward. And everyone's like, oh, we should avoid the doming. But I'm not afraid of it anymore. I'm not as afraid of it as, like I think that when we are standing, our recti or that linea alba is being stretched anyway, that the doming is just a different variation of what's happening in standing. And so I'm not as concerned about the doming with my clients while they're exercising as I used to be. And I think it's more important to just keep those recti muscles strong, the oblique strongs, the TA strong, like keep your entire abdominal wall strong during pregnancy. Okay. And then remember when so then now we've had the baby, and immediately after birth, we need to start bringing the recti muscles as close together as possible for the first 8 weeks postpartum, because in that 8 week period, remember I talked about those type 3 collagen and type 1 collagen. Well, in 8 weeks' time, wherever the recti muscles are hanging out, that's where the type 1s are going to come back in and stiffen up the tissue. So if we can help approximate the recti muscles and bring them as close together in postpartum, then the type 1s are laying down in a more narrow position. And so I am a big fan of having people, I teach my mamas and I teach the students, that the PTs that come to work with me, how to do an oblique release. Because during pregnancy, oh, and wait, before I go there, I want to just say there will become a point in time in your pregnancy where doing a curl up or a crunch is actually impossible because the baby gets too big, right? So at some point, you're gonna have to roll over to sit up, and that's usually towards the end of the pregnancy. So as long as you can do a crunch and you can curl up, do it throughout your pregnancy. And just know as you get into those later weeks, as you get closer to that birth, it's going to be near impossible to continue to do that because it's biomechanically impossible with the baby being in there, okay? So just wanted to mention that. But back to after babies come out, we want to try to bring the muscles as together as possible. And because when that baby's in there when we're pregnant, it's really hard to twist and to lengthen the side wall of our trunk during pregnancy. And I want to release the oblique muscles and try to lengthen the posterior wall and that lateral wall to help bring the muscles together more in the midline. And so there's an oblique release that I teach my mamas, and I just wish every postpartum woman could do that after having a baby, because that will help to bring the muscles more to the midline after the baby comes out. And then what I want my mamas to do is to put your fingers, let's see, parallel to those recti muscles, and you put it in the midline and you sink your fingers in as much as you can. And then you do a head lift or you do a crunch. And I want you to find the motion that allows those recti muscles on either side of your fingers that are poking in the midline of your belly. Those muscles should be pinching on your fingers as you do that exercise. And just do crunches the first 8 weeks postpartum. Because our focus the first 8 weeks postpartum is approximate those recti muscles so that we can narrow that distance. So then when the type 1 fibers replace the stretchy fibers, it stiffens in a more narrow position. And then after those 8 weeks, then we can start focusing in on other things. Okay. I really like to see my clients at like that 2 to 3 mark, after 2 to 3 week mark postpartum. So there's another technique I like to do to release the recti muscles and just really help them to figure out how to approximate those muscles so that we can bring those tissues as close together, those muscles as close together as possible, as soon as possible postpartum.
Mhm.
And then once that's done, then we're good to go from there. Then we can start doing anything and everything with our belly is for the rehab. But those first 8 weeks, we should really just be focusing in on whatever helps to approximate those recti muscles towards the midline as best as possible.
You need to do the research. You know, just we need to
Yeah,
have that as a study, Lynn.
I know, right? Because Mary Ellen, nobody's looking at this in the research,
No,
right? All
no.
they're worried about is how far, and the biggest thing, the problem with diastasis recti research out there is that they are calling 22 centimeters abnormal when it is actually normal. It's like
22 millimeters.
millimeters, thank you. Sorry, that would be way too wide. Oh my gosh. I'm sorry. 2.2 centimeters, 22 millimeters. Thank you. They're using that as abnormal when it's actually the average postpartum for women.
Mhm,
And so all these studies, they're very few that are done really well,
mhm,
but they're bringing in normal people with the abnormal people, and that's skewing the results.
mhm,
And what I love about Taryn and what she does is she's got such a mind for the research that she can actually take a study and go, okay, here's what they reported. But actually, if you look at their data and we take out all those 22 millimeter or less people and we just look at the women that are, above that, then we get a whole different result.
Hmm.
And
Yeah.
that's where we should be focusing. So like that, the numbers and we can manipulate the data to say anything we want it to say.
Hmm.
But it
Yeah.
really, the research is telling us that it's the estrogen that changes so quickly post-birth, and the change in estrogen is what allows the stiffening of the tissues to change postpartum. And they're saying that, by 8 weeks, that's done. And that wherever your muscles are at 8 weeks, that's where your muscles are going to be, whatever separation you have. But I do not agree with that.
No,
Ellen's shaking her
no,
head. No, I
no.
agree. Right? No, we can still make beautiful changes in the tissue.
Years later, years
Yes,
later.
yes, yes. So, yeah, I don't like really fully going by the research because I
Hmm.
don't think it's telling us the whole story.
Right.
And I think you and my experience in the clinic is really what is, like my research is what's happening with my clients' bodies every day on the tables, when
Hmm.
someone lays on my table.
Alrighty, we are going to pause right here. That's a lot to digest. So we're going to do a little bit more next week on diastasis. Thanks for joining us for this week.